Hey, North Metro, thank you so much for tuning in. I am so very excited about our interview we have today. We are interviewing Dr. Mary Chatman, and she's Executive Vice President of Wellstar, and also she is the President of Kennestone Hospital right there down the road from us. And so, Dr. Chapman, thank you so much for joining us.
You're so welcome.
Yeah, we're just glad. I know your time is crazy right now. I can only imagine. And so just got compiled some questions and love just to ask you with that. And starting off with the crazy world that we now live in, as one who is leading out in this at Kennestone, I mean, life has gone from whatever normal was to now this new normal. And so give us some insight into that. What's that been like?
Well, I would say the first is, we have amazing people who work in our organization. Kennestone is the largest hospital within the Wellstar 11 hospitals.
Okay.
So we are very used to, in terms of the team, taking care of very sick patients. This new norm for us, though, is that what we've seen is we've had an increase in volume of patients that we've had to treat with COVID, but we've seen a decrease in the volume of some of our other services. So, for an example, with the shelter in place, you may have seen that we are not performing as we would consider elective surgeries.
Right.
So we perform essential surgeries, which means that that volume is decreased. So many of our areas inside our hospital, we're experiencing less volume, which on the good news side gives us an opportunity to laser focus on making sure that we care for every patient, especially those patients with this new pandemic, in the utmost high quality and with competent staff. So it is a new norm for us. With our team, there are fears related to the unknown because none of us know all the answers. And in some of it, we've learned as we have gone along. That requires an enormous amount of communication. And frankly, it requires an enormous amount of trust. And so the good news is that, we focused on having an engaged workforce. I'm a nurse by background, and so my team know that I have been in the trenches on the front lines for many, many years. And so that level of engagement has really allowed us to ensure that we're providing excellent care to the patients.
Yeah. Yeah. So give us, speaking of talking about doctors and the entire staff, I mean, what's it like to really like serve? I mean, this has been described as, like we're in battle, we're in war, and you and people like you and your team, your staff, you're on the front lines. And so what's that been like? What's that like to even lead out in that and what's it like to serve there?
Well, first of all, we to protect our team, if you were to come on our campus now and try to come in our organization, it's the opposite of what we have are usually doing. We always encourage patients to engage with their family members and their friends to come and see them in the hospital. We've limited visitation, which is a stressor for our patients. For our team members, we also recognize that they are out in the community and so have the potential to get exposed themselves, even in the community, to the COVID-19. So if you walk onto our campus and you're a team member, the first thing that you see is in the limited entrances, we've decreased our entrances to our organization. We screen every team member.
Mhm.
And so every team member gets a temperature check and gets asked a list of questions to make sure that they themselves are well.
Mm.
And that is an opportunity to protect them, but also to protect the patients that's on the other side of the walls.
Sure.
And so each of them are screened. And that's our doctors, our nurses, our ancillary, our support. The other thing that you'll see, which is a little bit abnormal in hospitals, is that, we were one of the first hospitals in this region to take an even more aggressive step related to protecting our team members.
Okay.
The CDC has put out a lot of information in regards to what we call PPE. You hear that conversation on television, and many hospitals have run out. And so there is a high level of stress. Well, we have been blessed to have connections with our vendors because we actually have a central supply, which in some organizations, there is an extra middle person in between ordering supplies and receiving supplies. Because Wellstar is very large, we have our own distribution center.
Okay.
And so we've been able to provide those PPEs to our team.
I'm sorry, PPE?
Personal protective
Equipment. Yeah.
equipment.
Okay. I want to make sure. I was like, I think I know what that is, but I'm not really sure. I want to make sure I clarify that. Sorry to interrupt you.
So that could be anything from gloves to a gown, a mask, to the more sophisticated PPE that we call a PAPR, which actually, again, make sure that the physicians are not breathing in, things that they shouldn't. So we were one of the first who we heard the voices of our team. And what our team said is, we know that you're using CDC guidelines related to how you distribute the PPE. But those of us who are in the building, even if we are not front facing and actually taking care of a patient directly, we still have exposure too. So we took a huge leap in our organization to say, every team member who is in the walls, in the hospitals, you have PPE. So going back to your question, one of the things you'll see, which is pretty abnormal, is everyone's walking around with masks on.
That's so good. So good. All right. Well, so let me ask you this. How's Kennestone specifically impacted by some of the issues that we're hearing in the national media? Regards, I mean, you kind of spoke to some of this, but just what about capacity? What about supplies and equipment? Clearly, you guys have your a great supplier already, but what's that like? How's that affecting y'all?
Well, from a capacity perspective, I think some would expect me to say that we're overrun and we're running out of beds, but that's not the case for Wellstar, and specifically not for Kennestone, and that's because while we have seen that increase in the COVID and the persons under investigation for COVID and patients, we've seen a decrease in the other patients. So what we've done is repurposed our beds. Our hospital is very large. We have 633 beds in our organization. And so many of those are ICU, they're step down, they're patients that are general med surge. So we've converted a lot of those beds to be able to take care of our COVID patients. So we still have capacity. We have a plan that we look at our volume every day so that if we begin to run out of space in the existing space we're in, we can move over to the next space and again, convert those rooms.
Okay.
We have, as a hospital, we have what we call negative pressure rooms. Those rooms are very important taking care of COVID patients because that allows the air to be sucked into the room, but not to be sort of distributed outside.
Okay.
In those rooms that we did not have negative pressure rooms, again, a creative thing that we've done and hospitals across the country have is that we've added what we call HEPA filters. And again, those HEPA filters give us the opportunity to keep the isolates that are in the room with the patient. And then the staff wear their PPE to take care of the patient. So we do have capacity. One of the things that has really truly is the difference in how we do business is because we have had a decrease in volume. We've really had to get creative about how we also repurpose our team. Because in those areas that the volume is down, especially like at Wellstar in our outpatient areas and some of our imaging and our outside the walls, those team members, basically, the work is not there. So we tried to get real creative in understanding, what things that they can do. And everyone has been super, super flexible to say, yes, I'll jump in and help here. So this has brought us closer together as a team as well.
That's so good. We've experienced some of the same things, right? And I'm sure many organizations have, right? It's like we just simply can't do some of the things we used to do. And so now we just like that repurposing. So that's great to hear. That's great to hear. So let me ask you this: sitting in a position of leadership there as the EVP of Wellstar and CEO of Kennestone, what insights and advice can you give us as you just lead through? And what have you learned so far that could be helpful for us as you lead through what possibly could be the biggest? I think it is the biggest health crisis of our lifetime.
Appreciate that. One thing is you just mentioned leadership. I have been at Kennestone for about 3 years. And I think if you would talk to my team, that they would tell you that because I started as a nursing assistant in healthcare, I know the experience. And so part of the leading is leading by example. I've had to balance that with also role clarity. So the example being is that I've had a few team members that said, Ms. Chatman, I haven't seen you on the front lines taking care of the patients like we are. And what I describe to them is, probably you don't want me to because I'm pretty rusty. But on the other hand, is that we all have roles. And my role as the leader of the organization is to stay connected to what's happening nationally, to be their liaison at the corporate level when we are working on, revising our policies and our processes, and to keep the team motivated and organized. So part of that I've learned is, if you ever heard that role clarity was important, it is absolutely important in a pandemic like this. The other is that the little things matter. I'm probably going to get choked up when I describe this, but I try to do things on a day-to-day basis that really tell my team that I love them. So last week I was at my desk and I thought, wow, I don't know how I can get to every team member. And so I looked on LinkedIn, and someone, I had to steal it because it wasn't my creative idea, had taken just basic sticky notes and wrote a message on it and had stuck it on every person's car. So I thought, well, I can do that. So I said, I'm busy. I know I'm supposed to go to this next meeting, but I wrote notes, and the note just said, you are a winner because you care. And when my team started to help me stick those notes on people's cars, before we could get all of the notes on cars, I had doctors calling me saying, why didn't I get one? And finally, I saw a posting on LinkedIn that about 8,000 people looked at that said, how amazing that is. Well, it's simple. But when we are in battle and we have team members who are leaving their families and jeopardizing their health because of their calling, as leaders, we have to acknowledge that. We have to let them know that we see it, and we just have to encourage them. So part of my role is to be that encourager, but I try to do it with not forgetting where I came from, because I was the person who was on the front line, and reminding them that I do have their back, and we're going to get through this together.
That's so good. And I think that's such great counsel. Sometimes I think we have to stop and remember it's like, hey, this is what you wanted to do. This is what you went to school for. And hey, we're paying you a salary. We're giving you a paycheck to do this, but it's so much more than that, right? Specifically in these times, and specifically where you are. I can only imagine the stress that you will, and the anxiety that you have to manage just in the employees that you have and the teams that you have. And so what a great idea. I'm just going to let you know, I'm going to steal that. So that was great.
You can steal it. I stole it from someone else.
Great. Well, okay, so let me ask you this. With the information with this pandemic, I mean, it's changing. I mean, I was going to say day by day, but it's almost hour by hour, right? I mean, it's changing all the time. How is it, are you able to just keep up with communication? Because you've got to communicate with government, you've got to communicate with your department heads, your team, the medical staff. There's a lot of people depending on you to make sure this is all happening. What things did you already have something in place that just worked well, or have you had to do some different things to change up the way you communicate?
Well, the beauty of Wellstar is that we're a very large organization. We're actually one of the largest healthcare organizations in Georgia.
Okay.
And so we have a formal organized structure called the HICS. So it's called the Hospital Incident Command.
Okay.
So that's operated out of our CEO of our health system, Candace Saunders' office. And so that has a collection of all of the leaders in the organization, so that we become, again, the sort of connections to the different components that we need. For an example, we have a dedicated person who is responsible for engaging with our local, state, and national government. Okay. And so that individual is responsible for making sure that that is the lane of expertise that he operates in and his team. So then that HICS structure, it allows us all to have a part and a role and to bring back to the greater whole. In each hospital, like Kennestone, we then have a hospital HICS. So that gives me the opportunity to do the same thing, but on a different scale. So in my hospital, I organize the leaders and the experts within those parts and pieces of running a hospital so that we're all collectively, at least once a day, in the same room talking about what are we seeing, what are our challenges, who owns that barrier, how are we adjusting, how's the staff doing, what are our issues that we need to take on in the next hour, like you said, and what are things that we need to study a little more. So Wellstar is very equipped to respond to such a pandemic, which is why I think that we were just talking yesterday at the Hicks, and we said, you know, it was quiet yesterday. You know, we hate to say the quiet word because, of course, just as soon as you say it, you know, something happens. But I reminded the team, it felt quiet because we got this. And we are all operating by way of that we're here for the right reasons, and we're trying to over communicate. So going back to your question, one of the other things that's important is how we communicate. So we do that formally. 3 days a week, we have leadership updates. And so we're able to push things out to our team via their phones, via the internet, the website. We also have actual local virtual forums that, you know, the individual presidents like myself, we conduct. And what we try not to do is filibuster them. You know, I usually talk for about 10 minutes to tell them how proud I am and anything that I feel like is things that they should know sort of as a collective team. And then I be quiet and I give them an opportunity to ask questions. And the questions that I don't know the answers to, I don't act like I do. I tell them that I'm going to follow up and get the answer. So some of this we're able to do because, again, this is what we do on a day-to-day basis, but the pandemic has made us absolutely step up our game. And I have an amazing team who's done that every day. My doctors, the nurses, we're all are doing things that we, like you just described. We all know what our roles are, but in a pandemic like this, we don't have people saying, I'm sorry, I'm not going to do that. That's not my job. We have people who are raising their hand that say, what can I do to help you?
Good. So good. So good. It's interesting that you and I, in many ways, are in the same kind of business. We're in the people business. We're in the care business, and we're all about people. But there have to be processes, and those processes need to really work so that we can care for those people. And so, I like your organization from an intricacy is way more than mine is. But just I commend you on that. That's just that you have a hard job, and so I commend you on that. That's great.
Thank you so much.
So, in any crisis, we can always find some bright spots, and I can only imagine that there are probably days in these past few weeks where it's been hard to find those, but I'm sure you've seen them. So, what are some of the bright spots you've seen?
I think one of the brightest spots we've identified, which we knew and we have felt every day, but it is the community engagement. You know, the bright spot is that we have an overwhelming, just as, you know, your organization saying, how can we help? And how can we engage? I asked the team to actually collect that information, and some of the numbers are just staggering. The example would be, we've had about 11,000 meals that have been donated to our team members.
Wow, that's so good.
We had organizations who, like construction companies and, you know, different businesses who they use N95 masks as well. We've had about 5,000 N95 masks that have been donated from the businesses who say, we use them normally, but since we're not using them, then you can have them. We've had community members making masks. We've had people delivering drinks. We've had, you know, people delivering goodie bags that say, you need some chapstick and some lotion because you guys are doing a lot of washing your hands.
Yeah.
So one of the bright spots that's been for me is our community engagement. Yesterday, Mayor Tumlin called me and he said, you know, I want you to know that there's going to be a person standing on your campus. He's going to have a red shirt on and he's going to be taking a picture. And I said, oh, perfect. Who will it be? And he said, it will be me. Well, he was putting up a sign that said Pandemic Hero Way.
Mm.
And so that is just a testament to, the community engagement bright spot. The other bright spot I would say that I've seen is, again, back to the people. That, one would think that, we would have team members who would say, I'm too afraid, I'm not coming to work and I'm not taking care of those patients. We've seen that this has pulled us together closer. And it really has demonstrated that we have a whole lot of people who understand why we're in this business. And at the end of the day, we all show up to do the right thing, and that is care for our patients. The last bright spot I would say is that, the sad news is that we have had people who have passed away. The bright spot that I have recognized, again, is that I have a team of spiritual people, because there are people who have died without family. And my team has done it with dignity. They've made sure that no person has died alone. So that's been my bright spot. As much as it looks like it makes me sad, it just makes me proud.
Sure. Wow. Well, I will say that personally, I appreciate you saying that. I know our church would love to hear that, because that's one of the things that has grieved all of us, right? I mean, just nationally, knowing that for safety, you can't come in and be with your loved one if they're going through this, but to know that we have in our hospital, in our community, that the team there, the staff there, are saying, no, they won't be alone. That is huge. Thank you so much for sharing that. That's huge. That's a bright spot now for us. So you kind of mentioned some of the unique ways that people have kind of rallied around. Listen, as a church, Dr. Chatman, we've been praying for Kennestone. We've been praying for all of the workers there. We've been doing this as a church. Every night at 7 p.m. We just send it out, social media. We have several thousand people involved with our church who call it home. And we just ask, hey, can we please be praying for those who are in Kennestone, those who are on the front lines? And that's everyone. That's everyone from, the top, from you, all the way down to, sometimes, as we've seen in the media, a lot of people get overlooked, like the people who are cleaning up in the rooms, the orderlies, and so they all matter. It's a well-oiled machine, and so they matter. And as we've been making some masks, we've had a lot of people in the church, men and women, by the way, making masks to cover over. I've told the men, I said, listen, a sewing machine is a power tool. You're just not using wood or metal, you're using fabric. So get to it. So we've had a lot of men who have actually been doing this. And so, we've done the, sending a meal actually this week just to demonstrate and just to show how much y'all all matter to us, and writing notes. And we've had hundreds and hundreds of notes and cards being sent. What are some other tangible things that you could tell us? What are some things that we could do as a community that we could just really, really encourage you all and serve you and support you?
I would say keep doing what you're doing. We need, supplies. We need, and when I say supplies, I guess I'll say that not as in, the things that are happening in like New York, because again, like I said, we've been lucky enough to, again, be able to provide for our team for their PPE protection. Our team loves food. And so they love to have a variation in food.
Yeah.
One of the most recent things that we did is that we turned off our cash registers at work. So we're providing our team with food for free while they're taking care of patients. But they love a variety of food. So they love sweets and snacks. I think you said the most important, and that is, keep our team in your prayers. But I would say not only the team, as you alluded to, also the patients who are here. We added some new technology this week that actually gives people iPads, so that they can, though they can't see their family on site, that they can, again, virtually see their family. So I would say keep us in your prayers, lift us up. Let us know that if you hear things in the community, to be our eyes and ears, because sometimes in a time like this, we don't know what we don't know. And so we appreciate when people give us feedback, especially if it's things that we, have opportunities to improve. We're open to those. We don't make excuses. So we love that kind of engagement with our community, because it just makes us better.
That's so good. Yeah. Well, listen, in minor ways and major ways, meaning y'all, we're in all of this together. This is our community, and this is a global thing. And just know that we are some of your biggest fans. And so,
Thank you so much.
as we see in Scripture, please do not grow weary in doing good. What you're doing matters. I know you know that, but just to hear it from a church right down the road, you matter, and what you're doing matters greatly. And so, thank you so much, Dr. Chatman. Very much. Thank you so much for just taking time to do this. I know you've got a lot going on. Hey, North Metro, thanks so much for tuning in. Dr. Mary Chatman there at Kennestone and Wellstar. And so we're going to continue to pray for our friends, our neighbors, our brothers and sisters there who are on the front lines there. Thanks so much for joining us, and we'll see you sooner than later.